Passive range of motion exercises are physiotherapy technique in which the therapist or the owner moves the joint or entire limb within a possible range of movement without contraction of a muscle, unlike active movement. By that, joint, soft tissue, and neuromuscular functions are maintained or improved. Thus, it is an indispensable part of rehabilitation in many conditions, as well as great addition to improving performance and preventing injuries in healthy, active dogs. Passive range of motion exercises are performed in patients with acute injuries or immediately after surgery, when active movement is not yet possible or desirable. In patients with chronic diseases, for example joint arthrosis and geriatric patients, as well as in paralyzed patients in which active movement is not possible. In this way, we maintain joint mobility, elasticity, and optimum muscle length. We prevent connective tissue adhesions and joint and muscle contractures. Passive range of motion exercises assist in the orientation and alignment of collagen fibers, thereby creating a stable and flexible scar. It also improves blood and lymphatic circulation, thus reducing swelling and consequently pain in acute inflammation, as well as improving the supply of tissues with nutrients. However, the articular cartilage is non-vascular, so it does not receive nutrients via blood, but from synovial fluid. Passive range of motion exercises improve circulation of synovial fluid and thereby nutrition of joint cartilage. Passive range of motion exercises are beneficial also for healthy, active dogs as part of injury prevention and performance improvement. They can be performed as a preparation for active exercises to achieve a greater range of movement, or after activity to wash out lactic acid from the muscles and maintain their pliability. Performing passive range of motion exercises after surgeries and injuries accelerates tissue healing and patient recovery. When not to do passive range of motion exercises. It should not be performed in dogs in which movement of the joint is contraindicated. In case of injury or surgery, always talk to your veterinarian whether passive range of motion exercises are appropriate for your dog. Exercises should be performed in a quiet environment without disturbance. Keep your dog comfortable while performing passive range of motion exercises, laid in lateral recumbency on a soft padding. When performing passive range of motion exercises, always stay within dog's comfortable range of motion. Under no circumstances, pain or discomfort should be caused to the dog. The principle is a gentle flexion and extension of the individual joint within a comfortable range of movement. With one hand, the limb is stabilized above the target joint, and with the other hand, the lower part of the limb is gently and slowly moved until the first signs of discomfort. Both hands should be placed as close as possible to the respective joint. During the exercise, the leg should be parallel to the ground at all times, and while working on individual joint, move other joints to the least extent possible. With one hand, stabilize the limb just above the digit joints. With the other hand, move all digits simultaneously into flexion and extension. For specific digit injuries, we move each finger individually. With one hand, stabilize the limb just above the wrist, and with the other hand placed just below the wrist, move the joint into flexion and extension. With one hand, stabilize the limb just above the elbow. With the other hand placed just below the elbow, move the joint into flexion and extension. Due to biomechanics of movement, the carpal joint will simultaneously flex and extend together with the elbow joint. With one hand, stabilize the limb above the shoulder blade, and with the other hand above the elbow, move the joint into flexion and extension. When extending the shoulder, the elbow joint will simultaneously extend. With one hand, stabilize the limb below the tarsus or just above the toes. With the other hand, move all digits simultaneously into flexion and extension. For specific digit injuries, we move each finger individually. With one hand, stabilize the limb just above the tarsus. With the other hand, just below the tarsus, move the joint into flexion and extension. In order to fully flex the tarsal joint, we must also flex the stifle. One hand stabilizes the limb just above the stifle. With the other hand just below the stifle, move the joint into flexion and extension. With one hand, stabilize the limb in the hip area. With other hand placed on the thigh, move the hip joint into flexion and extension. To flex the hip, the hand is placed on the back of the thigh. To extend the hip, the hand is placed on the front of the thigh. With hip extension, the stifle joint extends to some degree as well. The principle of bicycling motion is to move the entire limb and its joints through their comfortable range of motion in a bicycling pattern. The goal is to promote natural patterns of limb movement and preserve joint range of motion, which is why this type of exercise is performed primarily in neurological patients. Support the limb above the elbow and below the wrist. The limb is carefully guided in a circular forward motion through the entire natural range of motion, as if you were riding a bicycle. Support the limb above the knee and below the ankle. The limb is carefully guided in a circular forward motion through the entire natural range of motion, as if you were riding a bicycle. In patients after injuries or surgery and geriatric dogs, passive range of motion exercises can be performed 2 to 3 times daily with 10 to 15 repetitions per session, depending on the condition of the dog. For healthy, active dogs, it is advisable to include passive range of motion exercises into your warm-up, cool-down routine with 10 to 15 repetitions per joint. Especially beneficial is performing these exercises after activity when tissues are still warmed up. Warning: passive range of motion exercises are not the same as stretching. Stretching should never be done before activity, but always on previously warmed up tissues.